Well, we're here today representing patients and victims and survivors of hospital-acquired infections. Behind me at the Public Health Department, they're having a committee meeting for the Governor's Hospital-Associated Infection Committee. And it's basically an advisory board for Governor Schwarzenegger on how to implement reporting of infectious diseases associated with hospitals to the state government of California. 19 states have laws that make hospital infection rates public, but California is not one of those states. What we're here to do is make sure that the public and patients and victims and survivors are represented. What we want to make sure is that patients have a voice. The committee is made up of epidemiologists, representatives from all the hospital associations, all the various hospital groups in the state of California, also infectious disease specialists and representatives from the Public Health Department. But we also want to make sure that the public is represented. Myself, I'm a survivor of a hospital-acquired infection. I got necrotizing fasciitis after a routine myomectomy. And what that is commonly known as is man-eating flesh disease. I almost died. I almost had my left leg amputated. And it was totally preventable. And that's the thing about these hospital-acquired diseases. Over 90,000 people a year are dying from hospital-acquired infections that are preventable. Simple things like hand cleaning, hygiene, making sure that you wipe off stethoscopes, and making sure that instruments are clean, and anyone coming in and out of a room washes their hands before they touch a patient. If someone already has an infection, you wear gowns and a glove and mask so that you don't spread infection. Amending the cap is about accountability, because right now in the state of California there is an outdated and unfair law that is part of the MICRA Act. And the MICRA Act was instituted in 1975, and part of that law is a cap on non-economic damages for victims of medical malpractice and negligence, so that if you are injured or if someone in your family, one of your loved ones, is killed by a preventable medical mistake or infection, the maximum that they could receive in non-economic damages is $250,000. Well, in 1975, $250,000 could pay some medical bills. It could pay for nurses. It could pay for your expenses. My medical bills are well over $1 million. So in real terms, $250,000 in 1975 is only worth $60,000 now. And so a lot of times you can't even get an attorney to take your case because financially it's not worth it. So amending the cap is to make things fair and equitable, and when you make things fair and equitable, you have accountability. When a hospital makes a mistake, they know that the laws protect them, and it's hard for a patient or the heirs and the family of someone who doesn't make it to get an attorney. It's hard to get restitution. It's hard to get compensation. It's hard to even get help. Medicare has now said that if a hospital is responsible for a preventable injury or illness, or they cause harm, Medicare and Medi-Cal will no longer pay for the medical bills. So if the government itself, if Medicare and Medi-Cal are saying, wait a minute, you made a mistake and you're still billing for it, instead of saying we made a mistake, we can't in good conscience charge these people. We need to just do what's right to make them whole and healthy again. If the government itself is saying that, then the private sector needs to look at that and start holding hospitals accountable. If you took your car to a mechanic and he didn't fix it right, he wouldn't then charge you to refix it. And hospitals shouldn't be allowed to do that either.